Living longer, living healthier, living better than ever before. Welcome to Mountain Pacific's Healthy Living for Life, a weekly series that gives you the information, education, and expert insight you need to become an active participant in today's ever-changing healthcare climate. Here now is today's program host.
Every 65 seconds, someone in the United States develops Alzheimer's. People with Alzheimer's and other forms of dementia number in the millions. And while there is no cure, there are steps that can be taken to help make sure people living with dementia are cared for and treated with respect. Welcome to Healthy Living for Life, a show dedicated to helping you do just that. I'm your host, Beth Brown. Today we talk about what it means to be a dementia-friendly community. Stay tuned, we'll be right back. Welcome back. Joining us this morning is Nick Hart with the Montana chapter of the Alzheimer's Association. But before we talk to Nick, we wanted to share this video with you, which provides some national facts about Alzheimer's. So Nick, watching the video, it's shocking to see how many people are affected by Alzheimer's, and we're going to talk about that here in just a minute. But first, can you start out by explaining what Alzheimer's is?
Sure. One of the most common questions that we get is, what is the difference between Alzheimer's and dementia? And it helps to think of dementia as more of a general umbrella term that's used to describe the loss of memory and cognitive abilities severe enough to interfere with daily life. And there are actually dozens of different types of dementia. Again, it's an umbrella term. Alzheimer's disease is the most common. It's estimated that Alzheimer's accounts for between 60 and 80% of these cases. So it obviously causes problems with memory, thinking, and behavior. In the early stage, dementia symptoms may be minimal, but as the disease causes more damage to the brain, symptoms tend to worsen. Okay. So memory loss is the most common symptom, obviously. But you know, dementia can interfere with communication skills and the ability to use language, the ability to focus and pay attention, your ability to have good reason and good judgment, as well as your visual perception.
Okay, and there isn't a cure for Alzheimer's or other forms of dementia, but how are they treated?
So that's a very good question. There are two kinds of medication that have been approved, but they can't stop the progression of the disease. They may lessen or stabilize symptoms over time, but they can't stop the progression of the disease, and that's something that's important to remember. People with dementia can become irritable, anxious, depressed, and as the brain deteriorates, they can get angry and even physically and verbally aggressive. So we offer classes to help caregivers understand what triggers those behaviors.
That's great.
And to how to adjust the situation, be it environmental, physical discomfort. So for example, if a person gets agitated when it's noisy, you may be able to help that by creating a calm and quiet environment.
Okay. Are there risk factors that people should know about that maybe put them at a greater risk for developing Alzheimer's or other dementias?
The one greatest risk factor is age. Just by virtue of living longer, we're all at a greater risk of developing this disease. Most people with the disease are age 65 and older, but we estimate that nearly 1/3 of people 85 and older are experiencing some sort of dementia.
Wow, okay.
Yeah, but Alzheimer's is obviously not just a disease of old age. There are around 200,000 Americans right now under the age of 65 that have what is called younger onset Alzheimer's disease, and that number is growing as well.
Okay, wow. So are there early symptoms that people should be aware of, or how is Alzheimer's diagnosed?
So the most common early symptom is having trouble with short-term memory. So remembering something you just learned. We have a brochure that anybody can request. It's called Know the 10 Warning Signs, Early Detection Matters. And we know that early diagnosis is very important because it gives people a better chance to benefit from the treatments that we do have, and it allows more time for them to plan for the future. So there's no one test that can diagnose Alzheimer's or other forms of dementia. So if someone is having memory problems or is concerned about themselves or a loved one, they should talk to a doctor. Definitely. A doctor would do a comprehensive medical evaluation, one that includes a physical and neurological exam. As well, the exam would include blood tests and brain imaging to rule out other causes of dementia-like symptoms, like a medication related to another undiagnosed condition.
Okay, so we're about out of time here, but just really quickly, can you talk a little bit about how you tell the difference between old age and memory loss versus this could be dementia or Alzheimer's?
Sure. As people age, it's normal to have some memory problems. Obviously, we say that memory loss is a normal part of aging, but dementia is not. So that memory loss can look like forgetting the name of a person that you just met, but Alzheimer's causes brain cells to malfunction and ultimately die. So the memory loss that comes from that includes things like forgetting what roads you used to take home and that you've taken home for years, or forgetting the name of a longtime friend. No matter your age, if you're having memory issues, it's important to talk to a doctor about that. You should see a physician and find out what's going on.
Okay, great. Great advice. Thank you. So we do need to take a break, but coming up next, what is being done across the country and in local communities to support people with Alzheimer's and other forms of dementia? We're going to find out right after this. Stay with us. We'll be right back. Welcome back. With more than 5 million Americans living with Alzheimer's, there is a critical need for local support and services to help them and their caregivers deal with the disease. We're still talking with Nick Hart with the Montana chapter of the Alzheimer's Association. Thanks for still being here with us, Nick.
Sure.
So let's talk about the Montana chapter is just one chapter. Is that right? There are chapters all across the United States for the Alzheimer's Association.
It's true, yeah. Every state in the United States has at least one chapter.
Okay.
And we offer a host of supportive resources, educational programs for those who are effective, and that is a common core source of programs that is the same throughout.
Okay, can you talk a little bit about those common core programs? What do you focus on?
Sure. So we work with information and referral. That's certainly one focus. We have resources that help people with Alzheimer's and their caregiver gain access to community resources such as respite care, elder care, lawyers, financial planners, care services, that kind of thing. We also work with care consultation. We help people navigate through the challenges that the disease presents and offer education and support for every step of that journey that somebody might be on. Support groups are another big one. Volunteers, trained staff can support those groups and facilitate them. And obviously those are for people with Alzheimer's and those providing their care. Emotional support, it's really important for them to know that they're not alone. Safety services, people with Alzheimer's and other forms of dementia are especially at risk to wander, and if they're not found within the first 24 hours, the odds of them being found alive are slim.
Okay.
So that's something that we absolutely focus on. We offer Medical Alert Plus. It's an Alzheimer's Association program which gives people a 24-hour emergency response line to report when a person with Alzheimer's or another form of dementia wanders away from home or becomes lost. So we also offer other safety services to prepare first responders for those kinds of situations and how to navigate them. And then lastly, education. It's key. We offer a variety of educational materials on topics related to Alzheimer's and other related disorders. And we know, Beth, that people can do better when they have the information that they need to do better.
For
You can't know what you don't know.
Right, right. Okay, great. And so to make sure that you hit all of those core programs, Montana, like I'm sure other local chapters do, put together a plan. Can you talk a little bit about Montana's plan?
Sure, yeah. The Alzheimer's Association's Montana chapter, we feel very fortunate to work collaboratively with dozens of highly qualified and dedicated individuals and organizations from across the state of Montana in what is called the Montana Alzheimer's and Dementia Work Group. So over a 3-year period, this group identified needs that are specific to Montana and its communities. For example, throughout Montana, we have shortages of providers specializing in care for older adults and Alzheimer's disease and other dementias, even in more urban communities. We had 13 town hall meetings all across Montana to gather that kind of information from community members. We had similar meetings on several reservations in Montana as well. Okay. And using that feedback and research, the research we did about Montana's healthcare services and gaps that needed to be filled in communities, we developed 11 goals and recommended action steps to move forward with.
Okay, and we don't need to go into all 11 of those goals,
Sure.
But can you kind of give us an overview of what you're trying to accomplish across the state?
Sure. The goals of that Montana Alzheimer's plan and those of the Alzheimer's Association are naturally in sync. We want Montanans to be first of all, aware of and comfortable talking about aging issues, especially Alzheimer's and other dementias, and we want to make sure that people know about the available resources that there are to help them throughout that process. We also want people with Alzheimer's participating in decision making to the best of their ability so they receive dignified, high-quality, person-centered care. We want family caregivers to get support and feel valued, and we want healthcare providers to be able to diagnose Alzheimer's disease early and accurately and then introduce people to the effective interventions and support. And lastly, we need our policymakers to recognize this as a priority. We need our state officials to understand that this is a public health crisis. We've identified that with the Centers for Disease Control federally. It is a public health crisis, and we need their help with setting up support systems to make sure that we can continue to research Alzheimer's disease and better detect, prevent, and manage the disease.
So what have you been able to accomplish so far?
We published our state plan in December of 2016 and set about immediately establishing work groups to focus our efforts on various aspects of that plan, like developing a statewide PSA, public service announcement campaign, creating a resource brochure for providers to offer to families, and hosting legal workshops to help their families get their affairs in order. And in the last year, we have worked with our partners at the Office on Aging to secure funding to extend the reach of our services and supports to the area agencies on aging throughout the state.
Can you talk a little bit about why it's so important to make local strides to something that, as you mentioned, is a national public health issue?
Sure. With the prevalence of Alzheimer's, pretty much everyone, if they're not already, is going to have it affect their lives, either personally or through a loved one, a friend, or a family member. And given the long duration of the disease, the strain on Alzheimer's caregivers can last several years and produce serious declines in caregiver physical, emotional, and financial well-being. So Alzheimer's is bankrupting families, and it threatens to bankrupt our nation. Barring the development of significant medical breakthroughs, the number of people age 65 and older with Alzheimer's or another form of dementia may nearly triple from 5.7 million now to 13.8 million by 2050. So the total payments for healthcare, long-term care, and hospice for people with Alzheimer's and other dementias are projected to reach $1.1 trillion by 2050.
Okay, that is an expensive disease for people to take on, and unfortunately we do need to stop to just take a quick break again, but another goal of the Montana Plan is to build dementia-friendly communities. We're going to focus on what's happening to make that goal a reality right after this. Don't go away, we'll be right back. Welcome back. Nick Hart is still with us, and we're now joined by Patty Holcup of Dementia-Friendly Missoula. Patty, thanks for joining us, and I do want to talk to you about Missoula in just a minute, but before we do that, Nick, can you just start us out by explaining what a dementia-friendly community is?
Sure. It's a community where people with Alzheimer's disease and other forms of dementia and their caregivers are treated with respect and dignity and are encouraged to participate in community life. So it means informing the community, so it's a safe and supportive place for people with dementia, getting community businesses on board to develop dementia-friendly practices, putting emergency intervention and prevention programs in place so caregivers and other people in the community know what to do in the event of an emergency involving dementia, training law enforcement and other emergency responders appropriately, and then focusing on initiatives that take action against elder abuse, especially in healthcare settings like nursing homes or assisted living residences.
Okay, great. Thank you for that. And so, Patty, Missoula has taken this on. That's one of the communities in Montana working to become a dementia-friendly community. How did Missoula start?
Well, we got our start by having, there were about 4 or 5 people who were involved with a statewide effort to develop the Montana State Alzheimer's Plan. And we would meet every couple of months in Helena, so this group got to know each other in the car on the way there. And several of us had been caregivers, and we traded experiences and shared frustrations and gaps that caused some of those frustrations, gaps in the healthcare system. So as we collected data for the state plan, we realized that we weren't alone. And so we came back to Missoula and said, we want to do something about Alzheimer's to make things better for both people with dementia as well as their caregivers. The gaps were just an example of a couple. Upon diagnosis, a patient might ask, well, now what should I do? And too often the answer was, we don't really know. The other thing is early diagnosis wasn't always happening. People could come wanting, with concerns about cognition, but because of the misperception that there's nothing that can be done, I think that care providers weren't comfortable giving a very difficult diagnosis. The first year goals that we had was to raise awareness and provide support and education to individuals with dementia and their caregivers at the point of diagnosis. And the second year we added promoting a perspective change from a limitations-based cognitive decline diagnosis to a strength-based perspective. And that's when we began to think we want to move toward helping Missoula become a dementia-friendly community. We had 4 agencies who were very supportive of us: Missoula Aging Services, the Montana Geriatric Education Center of the University of Montana, and the Rural Institute from the University of Montana, as well as the Montana chapter of the Alzheimer's Association.
Okay. And you mentioned the gaps in the healthcare system. Can you talk a little bit about what you've done so far to help the healthcare providers be a little more comfortable with dementia and Alzheimer's?
Definitely, and that was our first efforts. Our first efforts were 2-pronged, focusing on primary care providers as well as the consumer of healthcare. We developed brochures that we could distribute to provider offices and clinics where they'd be in the waiting room so that folks who were being seen could take a look at these brochures. In the brochures were lists of community resources to answer that question, what's next? as well as 2 brochures from the Alzheimer's Association. Nick has just mentioned Know the 10 Signs, Early Diagnosis Matters, and Principles for a Dignified Diagnosis. That would help the consumer think of questions to ask and what to expect. We've also had 2 Friday morning medical conferences, one each year. These are continuing education times for care providers, primary care providers. A panel with to provide the subjective experience of either being a caregiver or someone with dementia. 3 people talked about their experiences. The one who had his dementia, about his experience when he received the diagnosis, what he went through as he was kind of absorbing this and realizing he needed to redefine his life, although he was still the person he always was, but just couldn't remember like he used to. We had a vendor table at the Missoula Montana College of Physicians annual scientific conference. And really tried to promote information about the new CMS code, which allows for care planning post-diagnosis. So that again addresses the what's next, do we do. We've had Dr. Hartley from the Alzheimer's Association, Director of Science Initiatives, speak at another medical conference, spoke to the University of Montana faculty and students primarily in the helping professions, and at the Western Montana Family Medicine Residency Program. So speaking to students who are coming up. And then for the past 3 semesters, we've also had the 3 semesters we've had students from Montana State University College of Nursing who have worked with our group for a program called Population-Based Nursing Care in the Community. They've learned a good understanding about dementia, a little bit about reaching out and engaging the community, and then they take some of our PowerPoints, our teaching PowerPoints, back to their fellow peers, primarily the junior students.
Okay. Sounds like you've done a lot.
Yes.
And that's great. And if there are other communities, I know some are already starting, but if people are interested, we'll make sure to put a website for them up on the screen. But we are out of time. So Nick, Patty, thanks so much for being with us.
Thank you.
All the best to both of you and your future endeavors as you work on Alzheimer's and other forms of dementia. And thank you so much for joining us this week. We hope you'll come back next week. Until then, stay fit, stay well, and stay healthy for life with Healthy Living for Life.
Healthy Living for Life is brought to you by Mountain Pacific Quality Health. We'd love to hear from you. If you have suggestions for future programs, visit our website at mpqhf.org or call us at 406-443-4020. You can also catch us on YouTube by visiting our website and clicking on the YouTube icon. Special thanks to Fire Tower Coffee House and Roasters. Production facilities provided by Video Express Productions.